Since this is a facial surgery, the question of whether or not scarring remains is a very important point. As you just said, if the person is a man, he does not always have the option to cover it with his hair like a woman. What do you do? Does it scar?
Since we perform this surgery from behind the ear, it is impossible for people to see this scar. Our field is called aesthetic plastic surgery, so naturally we are extremely careful regarding scarring. The scar is minimal and hidden behind the ear, so it is invisible. No one will notice.
Swelling and bruising are a process that can generally be experienced after these types of surgeries, especially after aesthetic interventions. What would you say? Does swelling and bruising remain?
You will not experience severe swelling or bruising. If it does occur, it will resolve completely on its own within 7 to 10 days. About 1 week later, our patients, very comfortably, can go out in public by tying their hair up in a bun.
It does not require a hospital stay, does it? How soon after the operation can a patient return to work or school? How much time must pass before they can bathe and resume daily activities?
In surgeries we perform with local anesthesia, we can send the patient home after resting for half an hour to an hour. When using general anesthesia, we ask the patient to stay for 5 to 6 hours until the anesthesia wears off, though an overnight stay is not required. They can leave the same day. You mentioned asking when these patients can return to social life and their work. I specifically avoid using large, bulky bandages after these operations. I do this because I do not want them to draw attention. I use 4 finger-wide hairbands for post-operative dressings. I use the type of hairbands often called tennis headbands. It is not even noticeable that a surgery was performed, especially in women. It may look a bit more comical on men than on women, but it is still much more acceptable than bulky bandages. We call these patients for their first dressing on the 3rd day after surgery, and for the first 3 days, we do not want the surgical site to get wet. 3rd day dressing now. And after that, we are in a position to leave the ear open, and we allow our patient to take a bath, provided that they are gentle, of course.